Good morning, everyone. Welcome back into North Dakota today. Well, Movember is a movement to bring awareness to men's health conditions, and Apex Physical Therapy and Wellness Center is here to make it happen. With Brooke and Madison. Good morning, you two.
Good morning.
Good morning.
Yes, thank you so much for joining us, and I love the shirts.
Thank you.
So tell us how Apex is celebrating this.
Well, Movember is a nationwide movement to bring awareness to some particular men's health conditions like mental health, suicide prevention, and then the part that we feel the most called to is prostate and testicular cancer awareness. Apex has one of the largest pelvic floor therapy teams in our region, and so we just want people to know that we are here to help with those conditions that affect men's health, because I think a lot of people don't know that physical therapy can be helpful in the prostatectomy realm or with any pelvic cancers.
Absolutely, and I think this would be something that's, often overlooked.
For sure. And so we're having a little fun this month with letting people know that Apex does have a men's health physical therapy team, and so all of us have been sporting some mustaches, whether we're able to grow them naturally. Our team is not necessarily growing the natural form. In fact, we just do we opted to not wear our mustaches here on TV today.
Yeah, here we go. So you mentioned, I'm going to try not to butcher this word, prostatectomy?
Yes.
Yes, so you do rehab with that. Do you want to fill us in?
Yeah, absolutely. So men can come in even prior to having prostatectomy surgery. And so when they come into rehab to see us, we're going to work on making sure those muscles are strong, making sure that they're fully functioning and that they're able to control the bladder and other functions of the pelvic floor. And so once they do have the surgery, most men, not all, but a lot, will experience some level of maybe urinary incontinence. And then after any surgery, there's going to be some pain. Depends on the severity of it. But our job is to make sure that once they come out of the surgery, that they are not having the pain, because the muscles don't want to function if they're tight and sore. So we do a lot of techniques to try and relieve that. And then on top of that, if the muscles aren't strong enough to hold urine in the bladder, we want to make sure those are functioning and strong. So we treat a lot of abdominal wall strength and pelvic floor strength, and we look at breathing mechanics, and that's just really scratching the surface. There's a lot more to it than that, but in a nutshell, that's what we do.
We use some great technology too, like a biofeedback device or an ultrasound device that shows that you can actually contract and relax the pelvic floor. And just as Madison said, it really helps the quality of life after prostate surgery, when sometimes you're left wondering how you're ever going to be back to normal. Physical therapy can help.
Absolutely. So how does that feel for you two to be able to help people in this way?
It feels awesome. People are really at a vulnerable place in their life when they come in with pelvic floor dysfunction, and I think our team does such a wonderful job at making people feel at ease and helping people feel more comfortable talking about this, because it's not something you have to live with. It's not a normal thing to have to deal with, but it isn't uncommon. So we really want to bring awareness to that.
Absolutely. So where are you located, and how can patients get in touch with you?
Yeah, probably the easiest way is to go to our website. apexptwellness.com has all sorts of great resources, from blogs to our phone numbers, to call and get an appointment or even a free screening. And we are located all throughout kind of southeast North Dakota, with 3 locations here in Fargo-Moorhead area, West Fargo, and Jamestown and Lemoore, and Edgeley.
Yes. And why would you really recommend someone to reach out?
It's hard to make that first step in getting help to come and see a pelvic floor therapist. A lot of people are recommended and referred by their doctors, but not all. So I really think it's important that people just take that first step to come and get treatment, because it's like I said, it's not something you have to deal with, and it's really important to get that function back for a better quality of life.
Absolutely.
I think they'd be surprised at how easy it is to talk about your condition and to just feel at home among our team of pelvic therapists at Apex.
Wonderful. Well, I really commend you ladies for the work that you do. This is wonderful.
Thank you.
Thank you.
Yes, thank you so much for sharing that with us.
Yeah.
Yes, of course. All right, everyone stick around. I actually got to take a special look at the Fargo Force hockey team, and I have all the details after the break.